Mental Health Act needs to be reformed because the language is outdated, it's not compliant with human rights legislation such as the European Convention on Human Rights, it's not compliant with the UN CRPD, the UN Convention on the Rights of Persons with Disabilities. A historic opportunity for us to reform the Mental Health Act. It really needs to be changed, and I think we have a recent dark history with institutionalisation in Ireland, and we have an opportunity now to be world leaders in mental health legislation. So we're really looking forward in mental health reform to working with people and key stakeholders to bring forward this reform. We need it to happen as soon as possible though.
Do I feel like my rights and wishes have been respected by the Irish Mental Health Services? Well, that has both positives and negatives. There was no choice regarding the medication to be used, and no information was provided on the medication. I found the admission interview technique at that time, where I was confronted by 3 doctors facing me and 4 nurses standing against a wall in a confined space, was quite intimidating, even though they were all polite. I had questions fired at me, and my responses were influenced by my mental and emotional distress. In the end, I would have responded with anything to get out of the room. Physical restraint, where you are held down by a number of nurses and forcibly injected for just resisting medication or an increase in medication. Everybody should be entitled to have the capacity recognised. Just because they're mental health patients doesn't mean that they lack capacity to make decisions about their medical or ECT treatment.
We really have to make sure that we all come together to tell our elected representatives about the changes that we want. Unless we tell them about the changes that we want and need, it's not going to happen. People with mental health difficulties deserve to have their rights protected and respected, and they shouldn't have to wait any longer.